Welcome to the July issue of the Journal of Vascular Surgery, Venous and Lymphatic Diseases. We have a number of outstanding papers in this issue, and I would like to highlight 4, which are available free if you would like to read them. The first paper, Catheter-Directed Interventions Compared with Systemic Thrombolysis Achieve Improved Ventricular Function Recovery at a Potentially Lower Complication Rate for Acute Pulmonary Embolism, by Avgerinos from the University of Pittsburgh, was presented at the annual meeting of the American Venous Forum. It's a single-center study of 327 patients with acute pulmonary embolism, comparing 103 patients who received systemic thrombolytic therapy with 213 who received catheter-directed thrombolysis directly into the pulmonary arteries. Within each group, there were different doses of lysis drug and different techniques for catheter-directed thrombolysis based on physician preference. The authors found that catheter-directed thrombolysis was associated with improved cardiac function, particularly when used for massive pulmonary embolism. The other clinical outcomes, such as bleeding, were comparable when stratified by severity and extent of pulmonary embolism. The authors concluded that catheter-directed thrombolysis is at least comparable and may actually be superior in reducing complications such as bleeding, while it improves cardiac function. The next paper, Clinical Outcomes After Varicose Vein Procedures in Octogenarians within the Vascular Quality Initiative Varicose Vein Registry, is the editor's choice this month, by Sutko and co-authors from the University of Michigan. They reported on prospectively collected venous registry data from the Vascular Quality Improvement Program of over 12,000 patients with various ages who had symptomatic venous disease, consisting of varicose veins, edema, lipodermatosclerosis, or venous ulcers. Over 3,000 patients were over 65 years of age and 400 were over 80. As patients' ages increased, the frequency of single vein ablation procedures also increased. However, all patient groups, including those greater than 65 and particularly those greater than 80, had a significant improvement in their venous clinical severity score, without a significant increase in complications, even though more patients over 80 were anticoagulated. The authors concluded that all ages of patients, when properly selected, may benefit from venous procedures for CEAP 2-6 disease and benefit with improved symptoms and a reduced clinical severity score, and that fewer procedures are often used in elderly patients. The next paper, Economic Implications of Endovenous Great Saphenous Vein Ablation in a Public Health Care System, was presented at the annual meeting of the Canadian Vascular Society by Butt and co-authors. The paper examined the 10-year impact of introducing the new technology of endovenous laser and radiofrequency ablation of the saphenous vein on venous procedural volume, as well as the financial impact of these procedures in the Saskatchewan region. The authors found that the overall volume of saphenous venous procedures remained stable, the frequency of stripping and ligation was reduced, and the impact of the minimally invasive saphenous vein procedures significantly reduced venous procedural healthcare costs in the region. The final paper for this issue, Clinical Characteristics and Outcomes of Patients with Multiple Simultaneous Superficial Vein Thrombi, by Chopra and co-authors from Stony Brook and Tucson, describe the characteristics and outcomes of patients with multiple unprovoked superficial venous thromboses to determine whether these patients have a higher risk of cancer, thrombophilia, recurrent DVT, or death when compared to a single episode of unprovoked superficial thrombophlebitis. They identified 24 patients with multiple unprovoked SVTs. 20% had cancer, 42% had thrombophilia, and 38% had recurrent DVT during a minimum of 3 months follow-up, and 16% died. The risk of adverse events were significantly higher in patients with multiple unprovoked SVTs than in patients with a single episode of unprovoked SVT. We hope that you enjoy reading each of these papers and the many other excellent papers in this issue of the Journal of Vascular Surgery, Venous and Lymphatic Disease. Thank you for your attention.